For the last several weeks, we've been providing you complete and documented information on Catholic Relief Services projects that are directly involved in the promotion of contraception, condoms, and even abortion. In the first video, we spotlighted CRS documents that promoted condom use. In the second video, we showed you how CRS is the proprietor of an internet library that houses documents promoting contraception, abortion, homosexuality, and condom use. In the third video, we proved to you that CRS created a health referral network in Cameroon that includes Planned Parenthood-like organizations. In this report, we'll show you information that is so shocking we could hardly believe what we saw it when we saw it a year ago. Catholic Relief Services created a health referral network in Nigeria, like the one in Cameroon, but CRS's connection with the promotion of contraception in this network was even more direct, if it's even possible. All of this and more coming up in this special report from the Lepanto Institute. Since the publication of our first report, Catholic Relief Services and some elements of the USCCB have been quick to defend CRS's activities. In one statement, CRS boldly claimed, quote, "To reach those who need our help, we also participate in humanitarian initiatives undertaken by a wide range of groups, such as governments, other faith communities, and secular institutions. Although some positions and practices of these institutions are not always consistent with the full range of Catholic teaching, CRS's association with them is always and only focused on activities that are fully consistent with Catholic teaching." First of all, CRS's claim that some positions and practices of organizations that CRS partners with are not always consistent with the full range of Catholic teaching is both disingenuous and intellectually dishonest. The truth is, these groups are actively fighting against Catholic teaching, and CRS knows this. But what you're about to see will prove that CRS's work with agencies that actively fight against Catholic doctrine are not always and only aligned with the moral teachings of the Church, as CRS claimed. In fact, what I'm about to show you is shocking proof that CRS created a mechanism to bring pro-abortion and contraception-spreading organizations into a referral network for services specifically related to sexual and reproductive health. The net effect is that young people put into the system created by CRS are being referred to agencies where they can obtain contraception. From 2013 to 2018, CRS was given a $41 million grant from USAID to lead a project called Sustainable Mechanisms for Improving Livelihoods and Household Empowerment, or SMILE for short. On a one-pager of the SMILE project, CRS explained how the project worked, saying, "SMILE empowers local civil society organizations, CSOs, through an umbrella grants mechanism, where CSOs receive sub-grants to bolster their technical capacity and deliver high-level quality services at the community level. SMILE facilitates collaboration between CSOs and community stakeholders to promote local ownership and sustainability." Let me put that into plain English for you. SMILE is giving money to local agencies called CSOs that provide certain services to the community. On top of that, SMILE is helping them to work together in mutual support so that they will provide an integral infrastructure that will last beyond CRS's involvement. And one of the biggest problems with the SMILE project is the inclusion of sexual and reproductive health programs. The CRS SMILE fourth quarter report for fiscal year 2015 indicates that children clubs facilitated through the SMILE project are educating children on sexual and reproductive health. Here's what it says. Apart from child protection issues and life skills, children clubs also received adolescent and sexual reproductive health education, such as on HIV/AIDS. CRS's Quarter 3 report for the same year specifically stated that certain groups were promoting sexual and reproductive health in youth centers. AGCOD and KHF in Benue established youth-friendly centers to promote sexual and reproductive health. In 2018, CRS published a technical guide on savings groups for adolescents and youth affected by HIV, which addresses the add-on services of sexual and reproductive health related to adolescent and youth savings groups, and the SMILE project is acknowledged as helping to write and review this guide. At the beginning is a disclaimer which states that CRS follows its teaching on health and HIV, including family planning and HIV prevention. Publications and websites cited in this guide may contain information that is not aligned with these teachings. Their inclusion in this guide does not represent an endorsement of their content by CRS, nor does it imply that CRS follows these materials in its programming. Despite this disclaimer, the guide further claims that contents of the guide are the responsibility of Catholic Relief Services and FAHCI 360. In other words, CRS takes full responsibility for the inclusion and promotion of sexual and reproductive health contained in the guide itself, but then exonerates itself from responsibility of the same. On page 31, CRS indicates that youth groups and savings groups can act as a platform for add-on services. Here's what it says. AYSGs can serve as a platform for additional or add-on services either prior to or after group meetings. Savings groups with add-ons are sometimes referred to as Savings Group Plus. On the same page, CRS clearly identifies sexual and reproductive health as a possible add-on service. The point here is that an integral part of CRS's SMILE project is the inclusion of sexual and reproductive health services. This is important to keep in mind because the referral network established through CRS's own recruiting efforts include organizations that provide or promote abortion, contraception, and condoms. On CRS's SMILE project website, CRS shows that in 2015, it personally recruited and vetted CSOs for the SMILE project. Here, CRS calls for CSO applications. Here, they state CSO eligibility. And here, you can see the applications are obtained and submitted to crs.org. Another page on the CRS SMILE website provides the list of CSOs that CRS had chosen for the project. Of particular note is the claim here that CSOs, quote, were selected after various stages of technical screening. Among the CSOs chosen by CRS are pro-abortion, contraception-pushing organizations such as Lift Up Care Foundation, Teens and Youth Empowerment, Girls Power Initiative, and Family Health Care Foundation. We'll start with the Family Health Care Foundation, FAHCI. We'll call it FAHCI for short. What you're about to see is that FAHCI is a civil society organization working in CRS's SMILE project in several locations in Nasarawa State, Nigeria. On one page, with the list of CSOs, CRS provided a brief write-up on FAHCI, specifically acknowledging its work in the field of reproductive health, identifying it as number 1 of FAHCI's thematic areas of focus. But this write-up is a total understatement. FAHCI just so happens to be on Planned Parenthood Global's payroll during its participation in the SMILE project to push injectable contraceptives in Nigeria. In its own 2017 annual report, FAHCI identifies itself as a participant in CRS's SMILE project and provides a host of details regarding its reproductive health services. On page 32 of the document, FAHCI indicates that it worked with CRS in fiscal years 14 and 17 to implement the SMILE project. On page 26, listing the proposals it submitted to various organizations for further funding, FAHCI states first that it submitted a grant proposal to CRS in 2016 to implement the SMILE project, and on the very next line, FAHCI states that it provided a funding request to Planned Parenthood Global for a project to provide reproductive health information and services. It's important to note these grant proposals were for projects FAHCI was already undertaking both with CRS and Planned Parenthood. The listing on page 26 states that it is applying for a 5th year of funding from Planned Parenthood on reproductive health information and service project on Cyana Press, which is an injectable contraceptive, for the general population, especially women and youths. And 2 lines lower, FAHCI states that it is applying for a 3rd-year grant from CRS. Of particular concern is that FAHCI didn't merely apply for funding from Planned Parenthood while working with CRS in the SMILE project. FAHCI was implementing contraception-promoting programs at the same time and in the same place it was working for CRS on the SMILE project. In describing its work with Planned Parenthood, FAHCI states the following on page 31, quote, FAHCI provides comprehensive family planning information and services in the organization clinic, including 5 selected PHC, health services supported, Planned Parenthood Global. Page 16 of FAHCI's annual report listed the quantities of condoms, pills, IUDs, and injectable and implantable contraception that it dispensed at the clinic. And just to illustrate the point further, on its own Facebook page, FAHCI posted a picture of its executive director inserting a Jadel contraceptive implant into a client's arm. It should be noted here that FAHCI indicates that these contraceptives were provided throughout facilities they support in Nasarawa State. FAHCI's SMILE locations in Lafia, Shabu, Azuba, Tudun, Gwandara, and Amba are all within Nasarawa State, Nigeria. Of great concern regarding the overlap of FAHCI working with Planned Parenthood and CRS's SMILE project at the same time and in the same region is that both projects are focused on the youth. Page 31 of the annual report gave greater detail about its work on behalf of Planned Parenthood. FAHCI said there has been successful training of service providers in the 5 local government areas and included the following successes: procurement and distribution of Sayana Press to service providers, trainings for community health extension workers and youth peer providers to promote sexual reproductive health, and Sayana Press. Remember, Sayana Press is an injectable contraceptive. But FAHCI's connection to Planned Parenthood and SMILE isn't the only problem. FAHCI's work in microfinance programs for SMILE is also concerning. Remember, CRS published a document indicating that sexual and reproductive health programs can be added on to microfinance and youth programs. FAHCI is using microfinance education in order to promote contraceptive family planning at the same time and in the same locations it is discussing microfinance education for the SMILE project. Beginning on page 8 of FAHCI's annual report, under the heading, Activities Carried in the Year 2017, FAHCI says, the activities carried out within the year by microfinance are as follows: basic information on reproductive health issues such as child spacing, family planning, STIs, HIV and AIDS, safe motherhood, and make referrals where is necessary. On page 10, it shows similar numbers in relation to its microfinance activities and its promotion of contraception. 239 new clients have benefited from the microfinance loan. A total of 270 new clients have received reproductive health information, education, and services. And on page 12, FAHCI makes the following recommendations related to its microfinance programs. Need to always involve health personnel to provide reproductive health information during meeting with borrowers. FAHCI needs to identify more clinic facilities close to microcredit communities for easy referrals. Why does FAHCI need clinics so close to its microcredit communities? The answer is obvious: to give contraception to participants in the microfinance communities. And here's proof that FAHCI was implementing its reproductive health microfinance programs in the same locations as it was implementing microfinance programs for SMILE. CRS's SMILE third quarter progress report for 2015 shows that FAHCI was directly involved in the economic strengthening interventions in the SMILE project. Under the heading, Diversification of Economic Strengthening Interventions on pages 8 and 9, CRS reported FAHCI Lafia conducted financial education for 337 caregivers. So FAHCI was conducting financial education for SMILE in its Lafia location. Well, in FAHCI's own annual report, it shows that it was conducting its own contraceptive promoting microfinance programs in Lafia. On page 10 of the FAHCI annual report, it claims, quote, 5 new communities identified and benefited from the microcredit program in Lafia, also included Tudu, Gwandara, and Azuba. As we pointed out earlier, Tudu, Gwandara, Lafia, and Azuba are identified locations where FAHCI is implementing CRS's SMILE program. So just to drive the point home here for a moment, FAHCI itself states that it is pushing sexual and reproductive health and contraceptives during its microfinance trainings and names the locations. CRS says that FAHCI is conducting microfinance trainings for SMILE and names the same locations. Do you see the concern here? One more final problem that I'll mention about FAHCI, and there's a lot more in the full report, listed among the challenges to the completion of this project is this: religious and cultural beliefs impedes effective family planning services in communities. In relation to this concern, FAHCI provides some recommendations regarding its activities related to people living with HIV and AIDS. On page 20, FAHCI recommends religion clerics should be more diplomatically participatory in family planning messages. Clearly, FAHCI views religious objections as an obstacle to the spread of contraception and is more than happy to try recruiting priests for the purpose of promoting contraception. Given this utilitarian approach to the clergy, it really isn't a far step to using its partnership with Catholic Relief Services for the promotion of the same thing. The bottom line with FAHCI is that it is thoroughly committed to the spread of all manner of contraception, including abortifacients, with funding from Planned Parenthood. And this, while simultaneously participating in CRS's SMILE project as a networked CSO, taking part in youth and microfinance programs. There's simply no way that CRS was unaware of FAHCI's total commitment to the spread of grave moral evils, especially considering the mention of sexual and reproductive health activities within the SMILE project itself. What's worse is that in establishing FAHCI as a CSO within the SMILE project, a project that CRS is leaving, by the way, CRS has directly handed unsuspecting and innocent young people in Nigeria over to an agency bent upon the ruin of souls. But as we indicated, FAHCI isn't the only contraception-spreading organization identified in the SMILE project. Let's talk about this one, called Girls Power Initiative. Listed at number 15 on the CSO list, CRS provides a rather sanitized description of this organization. The truth is, GPI is a self-professed, feminist, stridently pro-abortion, contraception-promoting organization that works with International Planned Parenthood Federation, has created contraception-promoting curricula for girls, and actively seeks the decriminalization of abortion. By including GPI in CRS's SMILE project, even for an allegedly good reason, CRS is actively exposing their young girls to an agency that will destroy their souls. It's worth noting that CRS appears to be proud of its relationship with GPI, considering the public articles and presentations discussing their collaboration on the SMILE project. In June of 2018, GPI published an article about its participation in the SMILE project. Bearing the headline, GPI presents empowerment to 107 beneficiaries of the SMILE project, GPI announced, Girls Power Initiative, in partnership with Catholic Relief Services, has flagged off the presentation of empowerment to 107 beneficiaries of the SMILE project. SMILE is a USAID-funded project for vulnerable children in Nigeria through CRS. In addition to this, GPI produced a PowerPoint presentation on human sex trafficking in Nigeria, mentioning its work with CRS through the SMILE project. According to the results of GPI's collaborative work in the SMILE project, quote, there has been tremendous capacity building of GPI staff with training on HIV prevention, care, support, and referral. GPI has provided appropriate integrated vulnerable children services, which includes healthcare services. And according to the CRS SMILE second quarter report from 2015, GPI was directly involved in organizing meetings to discuss parenting support adolescent risk, HIV disclosure, child health, and development. Keeping in mind GPI's involvement in HIV and health-related projects for adolescents, take a look at this. In a 2009 booklet on feminist activism in Africa titled Voice, Power, and Soul, Portraits of African Feminists, the chair of the board and co-founder of GPI, Bene Madanugu, gave the following statement. She says that she helped co-found GPI in 1993 to pioneer sexuality, sexual and reproductive health and rights education for adolescent girls. She also indicates that she is a member of the International Consortium for Medical Abortion and a board member of IPAS. In her own words, Madanugu says, quote, "I also add my own energy to international efforts to prevent unnecessary deaths from unsafe abortions and promote women's rights to choice and access to safe medical abortions." Underlining this point, she later added, "As feminists, we are working collectively to ensure that all African women and girls are able to live safe, healthy lives and make informed and empowered choices about their own bodies." In 1999, Madanugu wrote an article for Catholic for Choice's publication called Conscience, arguing in favor of the legalization of safe abortion services. She wrote, "A high percentage of pregnancy-related deaths result from abortion complications because too many governments yield to political pressures from the Holy See against safe abortion services." In 2003, GPI published a series of training manuals on sex and reproductive health and rights. The manual was written by Bene Madanugu, and the write-up on the website, HIV Health Clearinghouse, illustrates that the contents of the manual include the background and guiding concepts of GPI, a chapter titled Pregnancy by Choice, followed by a chapter titled Contraception, and indicates that an activity consists of condom demonstration. In 2009, GPI actually helped to develop a contraception and abortion-promoting curriculum called It's All One. In fact, Bene Madanugu and Grace Osakue, the new chairman of GPI, are both identified as authors right on the inside cover of the curriculum itself. Other organizations involved in writing the curriculum are International Planned Parenthood Federation, IPPF Western Hemisphere Region. The curriculum is much what one would expect from a product of Planned Parenthood. It makes 89 positive references to abortion, such as this suggestion on page 231, which encourages kids to save girls' and women's lives by decriminalizing abortion, or on page 250, where the curriculum claims that maternal deaths can be prevented by use of family planning methods to reduce unintended pregnancies and access to safe abortion services. In addition to this, the curriculum makes 96 positive references to contraception and 66 references to condoms. Beginning on page 252, the curriculum provides information on the various forms of birth control, including whether or not the method inhibits sexual pleasure. More recently, in March of 2015, GPI published its Strategic Plan 20, which was its project and implementation plan for 2015 to 2019, setting goals and benchmarks for its activities. Throughout the strategic plan, GPI sets the stage for comprehensive sex education and the promotion of contraception and condoms by referring to the cases of unwanted pregnancies and how young girls then resort to illegal and unsafe abortions. As a remedy, GPI then establishes its intention to ramp up its incorporation of sexual and reproductive health education and services. For example, on page 5, explains that, quote, "Contraceptive use is low, and youth underestimate risks of unprotected sex and are at risk of unintended pregnancies, often resulting in unsafe abortion." As a remedy, GPI offers the following. Over the years, many organizations, including GPI, have been working to improve adolescent sexual and reproductive health through advocacy and prevention programming. This needs be deepened and intensified for sustainable impact. On page 49, in light of the expressed concerns established by GPI, it shows its intention to promote and encourage condom use. Under main activities, it says, promoting the use of condoms. Preference indicators state number of girls negotiating safer sex and use of condoms. On page 55, GPI states its objective to increase access of sexual and reproductive health services to 50,000 children and young people, facilitating access to and use of contraception. The stated goal is increased access of children and young females to sexual and reproductive health. Under main activities, it states, facilitate technical and material support to select PHCs to provide youth-friendly sexual reproductive health services, including contraceptives. And under performance indicators, it indicates the number using contraceptives. As I said, there's more information on this group in our detailed report, but the point is simply this. The inclusion of the Girls Power Initiative in CRS's SMILE project is beyond reckless. Whomever reviewed and vetted the organizations applying for inclusion in the SMILE CSO referral network could not have been unaware of GPI's open and flagrant promotion of abortion, contraception, and condoms. And yet, someone at CRS decided that this organization would be a good fit for a network that would last well beyond CRS's involvement. Between GPI and FAHCI, CRS is willingly exposing thousands of young girls to Planned Parenthood-affiliated organizations. And worse than that, these aren't the only ones. Let's take a look at the next one, the Lift Up and Care Foundation, or LUCOF. LUCOF is listed at number 7 on CRS SMILE's listing of CSOs. And once again, we see a rather sterile write-up about the organization. On LUCOF's website is a document titled Lift Up Care Foundation, SMILE Program Achievements, which encompasses its work in the SMILE project from 2014 to 2018. On the first page of the document, LUCOF provides a brief history of LUCOF's entry into and subsequent participation in the SMILE project. This is the basic timeline. In 2013, LUCOF responded to the expression of interest call by the SMILE project. LUCOF was selected after an organizational capacity assessment to be a CSO for the SMILE project. In March of 2014, LUCOF signed the contract and began receiving money from the CRS SMILE project. In 2015, Catholic Relief Services indicated its intention to double LUCOF's reach for vulnerable children and households, so CRS extended 3 more communities to LUCOF. Listed among its accomplishments on page 2 of LUCOF's document is a concerning indication that LUCOF may have been exposing young people to contraceptive indoctrination. It said, Health trained 60 adolescent girls on a module with 14 sessions covering sexual and reproductive health issues and HIV/AIDS prevention, with the aim of improving their lives and building their capacity to face challenges. At the end of the document, LUCOF indicated that CRS provided it with funding for the SMILE project. It said, Catholic Relief Services provided the funds to the tune of over 100 million Niara, which is approximately $276,000, to accomplish all of the above and more. The program officially kick-started March 2014 and ended August 2018. At issue, as with the other CSOs involved with the SMILE project, LUCOF is involved in the promotion and distribution of condoms. In fact, in LUCOF's 2015 to 2018 quadrennial report, which encompasses the same time in which it was involved in the SMILE project, LUCOF states that it distributed condoms in conjunction with another project, but in the same proximate location as its work with SMILE. On page 6, under the heading Impact Achievements and the bullet point HIV/AIDS, LUCOF writes as one of its achievements, quote, roadshow and campaign on reduction of stigma and distribution of condoms. On page 21, it actually gives the location and provides pictures of a condom demonstration that it conducted. Here's something else. LUCOF is a member of the Netzkraft movement, which describes itself as a cross-thematic and international network of more than 1,800 organizations around the world that engage in social engagement, social, political, environmental, or spiritual. LUCOF's own About Us profile on the Netzkraft movement website indicates that it distributes condoms. LUCOF's inclusion in CRS SMILE's CSO network will last well beyond CRS's involvement. LUCOF has made its involvement in the promotion and distribution of condoms quite plain, and so once again, The danger with Lukoff being a part of the SMILE network is that vulnerable young people are being introduced by CRS to an organization intent upon spreading spiritually poisonous ideologies. Before we close, I want to tell you about ActionAid, one of CRS's consortium partners on the SMILE project. As you can see here on CRS's SMILE project website, CRS identifies ActionAid and Westat as its two consortium partners in the SMILE project. In 2015, CRS published an overview of the SMILE project, giving details on what ActionAid's role in the project actually is. Page 2C says, ActionAid Nigeria is strengthening the capacity of the state ministers of women affairs and social development, the social welfare departments of local government areas, and the nonprofit partners working at the community level. In other words, ActionAid would be working directly with pro-abortion, contraception-spreading organizations that we just profiled. The problem is that ActionAid is itself thoroughly committed to the spread of abortion and contraception. On its own website, About Us page regarding emergency responses, ActionAid complains that during emergencies, women do not have access to abortion and contraception. Here's what it says. Sexual and gender-based violence increases during and after emergencies, but access to reproductive health services, contraception, and safe abortion is often reduced. In 2017, ActionAid publicly denounced President Trump's reinstatement of the Mexico City policy, which prevents federal funds from going to overseas organizations that promote or commit abortion. Calling the Mexico City policy the global gag rule, ActionAid gave full-throated support for access to abortion, saying, ActionAid firmly believes that women should have access to their full range of sexual and reproductive rights, and this includes access to information and safe abortions. In 2012, ActionAid produced a document that details its work in the field of sexual and reproductive health and rights. The front cover of the document shows a woman holding a pack of condoms, but the document specifically states ActionAid's full support for access to abortion. On page 16, under the heading Spontaneous and Induced Abortion, ActionAid provides a quote from a book titled Bodily Integrity and Conceptions of Subjectivity. The quote says, "The denial of the right to abortion enforces the kind of splitting that inevitably and continuously undermines a woman's sense of self. Her womb and body are no longer hers to imagine. They have even turned over the imagination of others, and those imaginings are then allowed to reign over her body as law." Immediately following this quote, ActionAid makes the following declaration. ActionAid firmly believes that women should have access to their full range of sexual and reproductive rights, and this includes access to information and safe abortion. There's a lot more detail on ActionAid in our full report, which you can read about on our website. But what all of this shows is that prior to working with CRS on the SMILE project, and even during and after, ActionAid loudly proclaimed that women should have access to all forms of contraception and even abortion. And despite this, CRS saw fit to make ActionAid one of its two consortium partners, even placing it in the position of strengthening capacities between local governments and nonprofit organizations. CRS might as well have appointed Planned Parenthood to do the same job because they really are no different. Here's the bottom line. CRS was the lead on the SMILE project, and one of its key partners was an organization that was vocally advocating for abortion and all forms of contraception. ActionAid should never have been a part of this project at all, and yet it was one of two consortium partners under CRS. To make matters worse, ActionAid's role in the SMILE project was to facilitate capacity building with local government agencies and nonprofits, indicating that it had a firm hand in the creation of the CSO network. And the CSO network indicated at least 4 organizations that are committed to the promotion and distribution of contraception, because this network is intended to last beyond the implementation of the project and is intended to be a self-sustaining mechanism. CRS is directly responsible for creating a referral network that included organizations that are no better than Planned Parenthood. In our next report, we'll prove to you that CRS both knowingly and willingly implemented a USAID program directed exactly at promoting and spreading contraception among the youth.